Ankylosing spondylitis AS. It's a musculoskeletal disease. Look at this picture, shows normal anatomy and ankylosing spondylitis spine, X-ray findings, CT, MRI findings, detail going on. Introduction. Ankylosing spondylitis is a chronic inflammatory disease that primarily affects the spine and sacroiliac joints, causing pain, stiffness. Over time, it can lead to fusion of vertebrae, resulting in a loss of spinal flexibility and characteristic hands forward posture. AS is a type of spondyloarthritis which encompasses a group of diseases with similar inflammatory features. A definition. Ankylosing spondylitis is a form of arthritis that particularly affects the axial skeleton, leading to inflammation of the vertebral joints. The condition can also affect other parts of the body, including the eyes, heart, and lungs. Types. AS is generally classified based on the affected regions and severity of the disease. 1. Axial ankylosing spondylitis affects the spine and sacroiliac joints. 2. Peripheral ankylosing spondylitis affect peripheral joints such as the hip, shoulders, and knees. 3. Non-radiographic axial spondyloarthritis, early stage of AS where changes are not visible on X-rays but can be detected via MRI. Causes. The exact cause of AS is unknown, but genetic factors play a significant role. The presence of the HLA-B27 gene is strongly associated with the development of the disease. Environmental factors and infections may also contribute to triggering the disease in genetically predisposed individuals. Risk factors. 1. Genetics. The HLA-B27 gene is found in most individuals with AS. 2. Family history. Having a family member with AS increasing the risk. 3. Age. AS often begins in late adolescence or early adulthood. For sex, men are more likely to develop AS than women. Complications. 1. Spinal fusion. Severe cases can lead to the fusion of vertebrae, resulting in a loss of flexibility. 2. Eye inflammation. conditions such as uveitis can cause eye pain and blurred vision. Three, cardiovascular disease. AS can increase the risk of heart disease and aortic inflammation. For lung problems, inflammation can cause scarring and reduce lung function. 5, fractures. Osteoporosis, the weakened vertebrae increase fracture risk. Pathophysiology. AS involves chronic inflammation at the sites where ligaments and tendons attach to the bone. The inflammation leads to the formation of new bone, causing the fusion of vertebrae. The exact mechanism are not fully understood, but immunomediated processes are believed to play a key role. Signs and symptoms. 1. Back pain, chronic pain and stiffness, particularly in the lower back and hips, often worse in the morning and after period of inactivity. Second, reduced flexibility. Over time, reduced spinal mobility. 3. Fatigue, persistent tiredness due to chronic inflammation. 4. Peripheral arthritis, pain and swelling in peripheral joints. 5. Enthesitis, inflammation at tendon and ligament attachment points. 6. Uveitis, eye inflammation causing pain and redness. Diagnosis. 1. Medical history and physical examination. Initial assessment of symptoms and family history. Second, imaging test. X-ray, MRI, CT scans to detect changes in the spine and joints. 3. Blood test to check for inflammation markers, example C reactive protein and the HLA-B27 gene. Nursing diagnosis. 1. Chronic pain related to inflammation and joint damage. 2. Impaired physical mobility due to joint stiffness and spinal fusion. 3. Fatigue associated with chronic disease process. 4. Anxiety related to the chronic nature of the disease and its impact on lifestyle. Management. 1. Education, teaching patients about the disease, treatment options and self-care strategies. 2. Pain management, medications, NSAIDs, TNF inhibitors, heat cold therapy and physical therapy. 3. Exercise, regular gentle exercise to maintain flexibility and strength. 4. Support groups, providing psychological and social support Treatment. Medications. 1. NSAID for pain inflammation. 2. TNF inhibitors, biologic drugs to reduce inflammation. 3. IL-17 inhibitors, another class of biologic drugs. For physical therapy, to improve posture flexibility and strength. 5. Surgery. In severe cases, joint replacement or spinal correction surgery. Psychosocial medicine. 1. Mental health support, addressing anxiety, depression, and stress management. 2. Social support, encouraging participation in support groups and connecting with others facing similar challenges. 3. Occupational therapy, assisting with adaptations to daily activities and work. Prevention. There is no known way to prevent AS, but early diagnosis and treatment can help manage symptoms and prevent severe complications. Genetic counseling may be beneficial for those with family history of AS. Conclusion. Ankylosing spondylitis is a chronic and potentially debilitating disease that primarily affects the spine and sacroiliac joints. Early diagnosis and comprehensive management, including medication, physical therapy, and psychosocial support, are essential to control symptoms and improve quality of life. Understanding this impact on physical and mental health is crucial for providing holistic care to individuals with AS. Thank you. Have a wonderful day.